Many people don't really, they hear of the word, but they don't know what the disease is. But it's good we have a medical doctor in the studio, Odunayo Talabi, to give us insight into what all of these things are. Good morning, doctor.
Good morning.
Now, when it comes to HIV/AIDS, everyone has a mental picture of what it is and how it ends. If you talk about Ebola, they have an idea. You talk about headaches, you talk about heart diseases, they know some of these things. You talk about typhoid, as the case may be. But when it comes to hepatitis, apart from the name, not so many people, like from the report you heard, not so many people understand what it is, what causes it, and what are the... Can you give us an enlightenment? What really is hepatitis?
Thank you. The comparison you made is, we can say, it's just a survival strategy on the part of hepatitis B virus. You know, it's not loud, it's not noisy, it comes into the liver, and then it stays there, not giving symptoms most of the time, and then over a long time, it keeps destroying the liver without the carrier knowing. So hepatitis itself generally is just inflammation of the liver, and that can happen through many ways. But viral hepatitis is when virus from A, designated as A to E, infect the liver. Most importantly, hepatitis B and C.
So basically, hepatitis is a disease of the liver.
Of the liver. So why we happen B and C is that those two are the most virulent. They are, hepatitis B, for instance, is more infective than HIV. We are looking at almost 100 times more infective, which means that someone with hepatitis B can easily spread it faster than someone with HIV, because the virus has the ability to survive outside the body for 7 days. If it's on any surface, it can stay there.
How will they spread it? If, for instance, if the person is infected, how?
Okay.
Is it spread?
Many means. Through sharing of sharp objects. In fact, let me just say, any means through which HIV can be spread, hepatitis B can be spread. Perhaps the difference is that body fluids, like saliva, hepatitis B has been found in even saliva, which is not so for HIV. So it can be spread through every means. HIV can be spread and more, if you want to put it that way. And then when it comes in, because it doesn't give symptoms, it stays there. 3 things can happen. It can come in very aggressively, that's very occasionally, and the person has yellowing of the eyes, very sickly, and then they go to the hospital, they diagnose it. Sometimes also, the person can actually clear the virus without knowing. Over 6 months, the virus comes in, the body immune system is able to overcome it, and then the person just gets well without knowing that something ever happened. But in other cases, it stays in the liver beyond 6 months and it becomes chronic. Those are the dangerous ones, because if it becomes chronic, then over time, that individual is prone to liver cancer and liver cirrhosis. In fact, in Nigeria and other parts of Africa, like 90% of people with liver cancer have had hepatitis B. For you to know the relationship between the two. So what we are now saying is that people should become more aware of hepatitis B, because it's something that can be in the body without one knowing. And if it is in the body for a chronic carrier, for example, without symptoms, it still doesn't stop the person from transmitting it to the next person.
So basically, you have to go for tests on time to know if you have it or not. But we're aware that it's so costly to diagnose. So how will the government or any other development partners come in here?
Yes. Well, the diagnosis is not the main thing. I think it's more costly to prevent, because the vaccines are not affordable to most Nigerians. So even when you screen and they tell you are negative, the next step ordinarily should be to get vaccinated, since we know that the vaccine can actually protect for life in some cases. Minimum of 20 years. So are you saying the diagnosis is as commonplace as it is for HIV?
Yes, it is. Is it which is more costly, the HIV screening or the hepatitis screening?
Well, HIV is cheaper because there's so many subventions and support for HIV. HIV is everywhere. People are
hepatitis B or C can kill faster than HIV. So you see my point?
Definitely. Yes, because I think the reason why there's so much focus on hepatitis B is that the vaccine has been developed since 82 and
1982.
82. Wow. And the World Health Body believes that the various governments will do the rest of the work of informing their citizens and then getting them vaccinated. I think it was when they discovered that the thing seems to be on the rise. Despite the availability of vaccine, that they discovered that people don't even know about it. So it was only in 2010 that they now put it as one of the very 4 important diseases that a day is designated as being for hepatitis. And now, only this year, that a policy direction was made on hepatitis B. That, okay, let's set a goal towards 2030, unlike HIV that has
eradicating
always, exactly, towards
now,
eradicating it.
Now we have issues of hepatitis A, B, C, D, E.
Yes.
What's the difference between hepatitis from A to E, as the case may be?
Yes, hepatitis A is a milder disease. Okay. In fact, it's transmitted fecal-orally. Someone with hepatitis A is stooling, he or she didn't wash his or her hand, and then somehow it gets transmitted to another person. Then diarrhea, mild illnesses, and the person recovers from it. Though hepatitis A also has vaccines. Now, hepatitis A and E are more or less the same. They are more or less the same. They are mild diseases. B, for example, D cannot occur without B.
Oh.
Okay.
D requires B to survive in the liver. So that makes B and C very important, because B, for example, has vaccines, and B and C are the only ones that have the capability of causing chronic liver infections, which can lead to liver cancer and liver cirrhosis. That is where they become more important than those other ones.
Okay, yes. We'll come back to this to have understanding, because there are so many areas we'll need to touch as far as this is concerned. Now, World Hepatitis Day is observed on July the 28th of every year to raise global awareness of hepatitis, a group of infectious diseases known as hepatitis A, B, C, D, and E.
The theme for this year's global campaign is Eliminating Hepatitis. Hepatitis is the inflammation of the liver. It is a curable disease, like we've been told this morning, but millions of people die from it due to unawareness and poor access to hepatitis treatment services.
Now, more than 1.3 million people worldwide die from either hepatitis B or C faster than they would from HIV/AIDS. Viral hepatitis affects 400 million people globally, and given the size of the epidemic, anyone and everyone can be at risk.
An estimated 95% of people with hepatitis are unaware of their infection. This is because hepatitis tests are complex and can be costly. At least it is costlier than that of HIV. It is estimated that only 5% of people with chronic hepatitis know of their infection, and less than 1% have access to treatment.
All right, hepatitis is spread primarily through contact with the blood of an infected person. Aside blood contact, other ways hepatitis can be transferred are being born to a mother who has hepatitis C and having sexual contact with a person infected with the hepatitis C virus.
Of course, now we know that even through your saliva, you can catch it. So approximately 70 to 80% of people with acute hepatitis C do not have any symptoms. Some people, however, can have mild to severe symptoms soon after being infected, including fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, and joint pain.
Okay, this gives us other perspectives now, but let us get the difference. How long does it take when somebody is infected?
Yes.
Between when infection comes in and when the symptoms manifest? How long? What's that period?
Okay, hepatitis B and C have incubation period between 30 days to 180 days. So it comes in, and then it starts acting on the liver cells almost immediately after being active. And then, like I said before, we have 6 months to differentiate between people who will clear the virus or who will fall ill immediately and those who will go on to become chronic carriers. So we are looking at a period of 6 months to make that distinction. So after 6 months, if someone is still positive of hepatitis B or C, we are looking at chronic carriers already.
But you said it's curable, it's treatable. So if,
yes.
if somebody's been on treatment for 6 months and is not, the sickness isn't clearing it, is that curable then?
Okay. Curability now is relative. Let's look at it this way.
Okay.
Hepatitis C, if diagnosed early, can be cured. In most cases, there are antiviral medications for hepatitis C that can, if the person takes it over a long time, one can become cured of it. Hepatitis B technically doesn't have a cure.
Oh.
Technically, in the sense that when one becomes a chronic carrier and one is tested, you now have to go further and do other tests to check if the virus is active. The virus is active or not. Now, I'm talking of a test that most people cannot afford. Most people cannot afford the test, aside the fact that very few centers in Nigeria do those tests. So when they now say, okay, this virus is silent, it's not active, so you are not so much at risk, then they can now say, okay, every year, check your liver, do an ultrasound scan, do liver function test, be sure you are safe. If the virus is very active at that point, then they place that individual on medication. The main goal of medication in hepatitis B is to reduce the viral load to a point where liver damage is minimized.
What about infection at that point? Even if you're on medication, can you still infect others?
Definitely. Definitely. If the virus is very active. Of course, for one who has a very minimal load of virus, the tendency of infecting the next person is much lower. So the goal is to ensure that every chronic carrier is treated to the point where they become less infective and then their liver becomes safer for them.
All right. Excuse me. Are they habits that people engage in or indulge in that make them vulnerable to hepatitis?
Yes. Aside from unprotected sexual intercourse and sharing of sharp objects. In fact, there is this common warning to mothers that they shouldn't chew food in their mouth and put in their baby's mouth. It used to be a very common practice. That they should stop that, because through that, hepatitis B can be transmitted.
What about the breastfeeding mother? Couldn't she have transmitted that to her daughter?
Yes, it's possible. In fact, one of the important means of transmitting hepatitis B, for example, and C, is through delivery. An infected mother passing the virus to the baby. But because the vaccine has been incorporated into the national immunization program, almost every baby in Nigeria is immunized against hepatitis B. So that protects them, which is the advantage of ensuring that those children get immunized.
Okay, so you were talking about what makes them vulnerable, habits or attitude that makes them.
Yes. Like I said, sharing of instruments, and then, of course, in households, they share materials generally, drinking,
because they are communal,
all those, exactly. So
everyone shares everything.
So that can make the thing spread. And then, of course, blood transfusion, using of unsafe injections, and all that.
So do you see a case of stigmatization in this particular case we're talking about, where the father is infected? Do you see him being isolated or quarantined as it is for fear of spreading the disease?
Yes. In fact, if you get to that point, it's one way of eliminating hepatitis B. The stigmatization is not there because people don't even know what it is. If a father comes and says, I have hepatitis B, the question, okay, so what do we do? But if he comes and says, I have HIV, everybody...
There's going to be panic.
Exactly. So I think if we get to that level where there is even some elements of stigmatization, it shows that the awareness is now even getting higher, But when people now hear about it and then they read about it and they know more, then they get scared. We have had cases where the mother will be finding it difficult to move close to the daughter who has hepatitis B and begin to ask, where did she get it from? Until you now educate them that these are the things they can do to keep themselves safe. And of course, anyone who is vaccinated is safe from whoever has.
So is the vaccine just meant for children or for adults as well?
For adults as well. In fact, it's almost more important for adults, because everyone born after 1990 in Africa, most probably didn't get the vaccination because it was only introduced into the immunization program at that time in the 90s. So adults need to get themselves even screened, tested and then vaccinated, much more so than babies who have probably had a shot or two at birth when they had the
so the vaccines are available now. We understand some development partners are pulling back in the areas of vaccine.
Yes.
Does that also affect hepatitis vaccines?
Yes. In fact, there has not been much support on hepatitis B vaccine particularly. We just have it out there. People have to just pay for it, and then we are talking of something well substantial for an average Nigerian, when it comes to vaccination. Most vaccinations are almost 10,000 naira.
So how much is
3 doses.
Oh, okay.
3 doses. It's in 3 doses. So, but aside the cost, people find it difficult to also complete the dosage. We are looking at vaccination that you take at the start, a month after, 5 months after. Most people don't complete it because it's difficult to even remember. So I know that people will tell you, is it that I don't know about it? Oh, I've heard about it, but I've not done anything about it.
But if the health centers are serious about it, if somebody is on vaccination and you have a duration, they can give you a gentle reminder, okay, you are due for the next vaccination, say in the next 1 month, the next and they keep a tab. Why are they not doing that?
No, I think there are now organizations that do that ensure that they follow you up. In fact, they can come to your house and give you the vaccine to ensure that you follow up on that vaccine. But health centers are mainly for babies vaccination, because those are the subsidized vaccines. Adult vaccination is not subsidized when it comes to hepatitis B. So, of course, for babies, they keep records. They tell you you are due in another 4 weeks, you are due in another 5 weeks. In fact, I can tell you that adults don't even see themselves at risk of hepatitis B at all. They don't. They don't. I'm talking of, in the last few months, I've been involved in like 5,000 screening, and of those that are positive, 9 out of 10 will tell you that they don't even know what hepatitis B is. And then they are not aware they are carriers. So that is just the situation. It's real. It's not, this one is not data from the United Nations or WHO. This is what is happening in Nigeria.
I actually got a report that we're about 2 million Nigerians who are infected already, at least confirmed infected Nigerians, about 2 million of them. That's a huge number.
That's a huge number.
Yes, we are talking of 20 million, not 2.
Wow.
That's not 20 million. The prevalence rate of hepatitis B is about 5 to 10%. And that's replicated everywhere. If you screen 1,000 people, you know the number you get. 10,000, you know the number you get.
Wow.
All right, but the point there is when we make comparison between the cities or the rural areas, is there any, when you make comparison, are people in the cities or who is more prone to this?
Everyone, in the sense that in the rural area, because of ignorance, which is almost across board now, ignorance. So mothers can, transfer it to their babies, and then practices that encourage HIV, which most people in the city will not do because of awareness, are still very much commonplace in the rural areas. But also in the cities is where you have practices that can make people prone to those viruses, like use of drugs by some people, homosexuality, unprotected sexual intercourse. So there's sort of a balance between the two when you look at it.
All right, wow. Dr. Odunayo Talabi, thank you very much for coming on the program.
Thank you very much.
Thank you. And we wish you World Hepatitis Day.
All right. Whatever.
It's just awareness of eradicating hepatitis across the world. Thank you.
Thank you for coming. All right, so we are going out now on TVC Entertainment, but our viewers there can continue with TVC Breakfast on TVC Nigeria on Consort Channel 190, DSTV 418.
You can also watch that on GoTV 45 and ACTV 510.